Hello and welcome again to this edition of FITV. I'm your host, Brad Swanson. We are coming to you from the amazing worldwide internet. Yes, we're the Florida Internet and Television Association, so we too like using Teams and Zoom and all the amazing platforms out there to reach out to our friends. Today we are joined by none other than the amazing Mary Mayhew, who is the president and CEO of the Florida Hospital Association. Mary, welcome to the program.
Thanks, Brad. So delighted to be here with you today.
Yeah, it's great to have you on. I know you've run multiple departments of health in multiple states, and you've got just a great lens on the healthcare industry nationally and as well as in Florida. You and I were talking a little bit about before this program on workforce and how important that is to your industry. Tell us what the association's doing and what's needed, and where is Florida's workforce for healthcare in Florida?
At the end of the day, our healthcare workforce are the heart and soul of our organizations. This is a service industry. We are supporting care 24/7, 365 days a year. So unlike other areas of our economy where you've seen some contraction, where they may not be able to be open 7 days a week, we obviously do not do that in healthcare, and certainly not in our hospitals. The pandemic was a gasoline can over the fire related to staffing shortages. We had shortages prior to the pandemic, but obviously the stress, the fatigue, the challenges that our staff faced throughout the pandemic exacerbated those shortages. Now, we've been working really hard over the last couple of years to recover from that. We've worked very collaboratively with the legislature, and the legislature really has been incredibly supportive of prioritizing additional resources for our universities, for our community colleges, to increase the pipeline of certainly with a big focus on nurses and physicians. Think about it, we're the third largest state in the country. We've got 1,000 people a day moving to our state, with many over the age of 65. So the demand for healthcare services in Florida is just skyrocketing. So we're making progress.
Good. Well, that's great to hear. So as the husband of a nurse who is continuing her growth and getting the next level of degree as a nurse, we sure appreciate that in our household. But as she went through that process, I was fascinated to see just how much the colleges and the universities are where it used to be kind of not competitive, but it was difficult to get the resources. And now they're just like, yes, you want to do that? Let's get you engaged. Let's get you, on the program. And it's been pretty accessible, at least from this household's perspective.
Well, I love that. And the other area, too, is that career ladder focus, which you referenced, right? The professional development. If I'm a CNA, how do I become an RN? And you've got a lot of programs of learn while you earn, or earn and learn at the same time, because so many people can't quit their jobs and go to school full time. So how do we both support their ability to pay their bills, but also acquire that next degree? The community colleges, the universities, really looking creatively at how to meet the needs of those new students. And then I would also say, Brad, we're also examining, what does the workforce environment look like? How do we leverage technology to reduce administrative burden? How do we, if a nurse is looking at retirement, maybe 3 years away, wants to get away from perhaps the demands of the bedside, but might be interested in doing remote monitoring of patients. So really getting much more focused on those array of opportunities for our workforce.
Well, I love it. You teased it, but we're going to come back to that question in a second, because both of those solutions require the internet. So I'm going to piggyback on that in just a second. But the apps and the ability for our household and my wife to earn and learn, and it's been fascinating to discover that world. So okay, we're going to pause there on that. We're going to go back to an item that you have been championing since you took the helm of the Florida Hospital Administration, but it really is to showcase the world-class health systems that we have in Florida. And I think I'm going to take our viewers back to 20, 30, 40 years ago, when Florida wasn't the system and it wasn't the place it was today. And people would still go north to Boston, New York, Chicago, Los Angeles, to the national, if you will, places where you go and get certain kinds of care. Now Florida has all of this to offer, and I love hearing you again. So share with our viewers the state of Florida's medical system, and really talk to us about how world-class it is.
Well, I'm incredibly excited about what we have here in Florida, the sophistication, the commitment to modern healthcare services, constantly keeping pace with the latest development, the new standard of care, if you will, for whatever treatment individuals may need in terms of cancer care, orthopedics, cardiac care. And at the end of the day, as consumers, as patients, what do we all want? We want that proximity to care, that we want our family to be near us when we're getting care. So we've got to make sure people understand what is in their backyards, that they don't need to go to New York City, to Boston, with all of the added stress and strain that places on the individual and their families, and the costs associated with the travel. So one of the things that we want to make sure that the legislature values, that the public values, is that you can't just have a healthcare system that's constantly hemorrhaging red ink, bailing out the boat, if you will. We've got to be charting a course. 1,000 people a day moving to this state, needing all of those healthcare services, our population growing. We want to make sure that the system is responsive to their needs. And back to workforce, we want to recruit the best and the brightest.
Right.
We want those physicians and nurses and other staff to come to the state. So we also want to be investing in graduate medical education, where physicians train and
where they stay.
It's where they stay. We
Right.
know that research is clear.
I didn't want to take your punchline out of here, but I've heard you say it enough. So I hope you've trained me enough to learn the taglines. So
exactly, that's a measure of success, that it gets repeated back to us. So I'm really excited about the path that we're on.
Well, and just, final piece, and I know you talk about this a lot, forever Florida was the gerontological, care leader, but now with Florida's diverse population, it's everything from pediatric to everything in between. And we have some of the deepest thought leaders and leading physicians and leading researchers on all aspects from Alzheimer, well, that is as typically associated with senior citizens, but cancer, even some of the boutique kids ailments that you just don't see people come to Florida to get their kids those treatments. So Florida is becoming that destination for best in care medical treatment. It's really fascinating. I love hearing you tell those stories.
It is, and it is amazing to see what is occurring. And often when it comes to healthcare, we're not as aware until we need it or till a family member needs it. Right. The other thing we've got to keep in mind, you can't just flip a switch and expect that healthcare system to be there when you need it if you aren't making those investments in the system. We obviously saw that during the pandemic. We experience it during hurricanes, when we have that intensity of dependency on our hospitals, on our healthcare delivery system. So we want to make sure that that commitment is sustained and that people are able to reach out and get the services they need when they need them.
All right. So before we jump into a little bit more of that, because I think we've teased that subject enough, behavioral care is one that you're constantly talking to the legislature about. What's going on there? What is FHA, and what are you either working on or highlighting?
I think we have seen over the last several years just a dramatic increase in the number of adults and children with mental illness at varying degrees, but certainly increased prevalence, depression, anxiety. And we have a mental health system, and this is not unique to Florida. This is a national crisis. It really has been extremely fragmented, very crisis oriented, and we've been focused on, and the legislature has been supporting increased commitments in the community. As I say, people don't have a crisis between 8 and 5, Monday through Friday. Right. How do we support mental health access? First of all, when they need it. When somebody needs treatment, it can't be, I'll see you in 6 weeks, I'll see you in 6 months. They need to get in the door immediately. It's got to have a 24/7 focus, but it doesn't need to be always an inpatient hospital bed. So the opportunity to support mobile crisis response, supporting our law enforcement with staff who are able to do crisis intervention, de-escalation of crises. Too often, county sheriffs will say we are by default the community mental health system. So, 20, 30 years ago, states responded either because of lawsuits or otherwise, and reduced the size of massive state psychiatric institutions or closed them. But it didn't mean that the people went away. So how to ensure that we've got a robust array of community services that, frankly, Brad, are a lot less expensive than an inpatient hospital bed, and far better for the individual with mental illness. And certainly that is also true in terms of substance use disorder, making those resources available when individuals need those.
Yeah, well, all very, very important, and just, kind of that sits under the subconsciousness, if you will, of a state, and, can either, if you're addressing it, can surge economies forward or hold them back, and, due to work latency and all all those sort of factors. So, all right, so we're going to move away from kind of the standard conversations, but we're gonna get into our industry, which is the internet and television industry, but it's working, what's the word I'm looking for, synergistically with the hospital systems across Florida. So Governor DeSantis has invested and let grants out to the tune of $500 million. We've got another $1 billion that the state of Florida is managing and disseminating, which means the most rural amongst Florida are going to now be getting in-home access to high-speed broadband, telemedicine, remote connectivity, remote management. Talk to us about, you and I have talked about this a lot since you've started at the FHA, and we've had this conversation, but tell our viewers a little bit about what remote care will do for the healthcare industry and the provision of care.
The one silver lining that we can point to out of the pandemic was the skyrocketing availability of and use of telehealth, telemedicine. We've been trying for years to increase the use of telemedicine. But as you point out, the availability of it is only as good as the technology and the broadband connectivity. But what we know about telemedicine is that it has helped to bridge the gaps in timely access to care, whether that is related to workforce challenges that has made it more convenient, more efficient to use telehealth. Transportation is often a barrier for individuals to get access to care. Think elderly couple that may have to travel from a rural area into an urban setting, from the country into Tampa, into Miami, where a telehealth visit can often not replace all, but can replace a number of visits where they're checking in on their diabetes, their management of chronic diseases. But what we've also seen in the last couple of years is just incredible increases in disruptive new technologies that are allowing for even greater monitoring of patients at home, hospital at home, the sophistication of that technology to support patients in who require hospital level of care. But where would you rather be? In your own recliner, in your own bed at home, but still getting truly that hospital level of care, but supported with 24/7 monitoring. Again, all dependent on that level of connectivity that we have around the state.
Yeah, it's really interesting, and it's been one of the pieces I've really enjoyed from our association to working with your association, talking about, connecting those people who are really, it's only, I say it's only 5% of Florida, but it's the 5% of Florida that are the hardest to get to, both geographically and from a connectivity standpoint. So I know our members are going to work hard over the next 2 years to wire up the rest of Florida. I know your members are going to work are working and have already kind of stood up their internal systems to have your doctors and nurses ready to provide that care, and they're doing it as people get connected. So I know we're going to be working a lot together going forward on these conversations, but anything else on that, you always know, you can call us at FITV and FIT to help you tell that side of the story, and obviously all the other great work that you do. Mary, in the last few minutes that we have, you have a big job, and you work with amazing hospital administrators and hospital systems across Florida. We're the leader in Florida. You tell that story nationally. When you're not doing these very, very important things, we're the internet and television industry. What are you streaming? What are you watching when you put your feet up at home to take your mind off it a little bit?
Well, let's just all admit, perhaps not all, but for me, certainly, there is therapy from the ability to stream and the entertainment that is so available today. I am currently streaming The Bodyguard. I got to tell you, there are a lot of British series lately that I've been able to find and enjoy. So
it's very good, starring Rob Snow. The actor from Game of Thrones. That's not his real name, but it's a great show. So all right, yes, you've got a little penchant for British.
No, I do. That's the focus these days.
All right. Well, we'll compare notes on that as we get into committee weeks. I know you and your entire team are already actively engaged across the state. We'll look to see what your priorities are, and hopefully we'll get you or a member of your team back on to talk about your priorities going into session. And Mary, thanks so much for your partnership, and thanks for coming on FITV. Really appreciate having you on.
Thank you, Brad. My pleasure.
Thank you. Good seeing you. That's all the time we have for this episode of FITV. Make sure you hit us up for more great interviews like this one on our social media feeds. And for now, thanks for tuning in.